So now in this video, we're going to go over the major branches of the coronary vessels, both arterial and venous. And to start it off, I'm going to actually flip back both my atriums here, so we can kind of get a greater appreciation for the left coronary artery and the right coronary artery. We're going to start with the right coronary artery, which has two major branches. The first one is the marginal artery, which if you follow down here, comes right off, and push that back in. The marginal artery, right here. And if we keep following it, now we're onto the base of the heart. You'll see the most important branch, which is the posterior interventricular artery. Okay, so remembering that those two, the marginal and the posterior interventricular, come off of the right coronary. And if we're going to jump now to the left side, so okay, back to my anterior view, opening it, you now see the left coronary artery coming out. And this directly branches into the left anterior descending artery. This is nicknamed the widowmaker, and the circumflex artery. And what's important about this widowmaker, or this left anterior descending artery, is in some models and in some people, you can actually see it converge and connect here with that posterior interventricular artery. And this forms a kind of fail-safe. If there's some type of occlusion, you still have blood flow getting through, and we can get further into which coronary artery circulation is dominant based upon this kind of system. But that's a bit out of the scope. For what we need to know is the name of this artery, the circumflex artery, and then on the back here, the marginal branch of the right coronary. Okay, so that's it for arterial. We're going to dive into venous. So we're still at the anterior surface of the heart, and this is where we see the great cardiac vein. Okay, the great cardiac vein runs. I'm actually going to close this, because now we don't need to worry about it. The great cardiac vein joins right into the the coronary sinus, which is this large vessel here, which will drain directly into the right atrium. If you haven't seen that video, make sure to watch that, and you'll see exactly where it comes through. The other two veins you need to know that drain into the sinus are on the base of the heart, and this is the middle cardiac vein, shown here, and also the small cardiac vein. And you'll see some variability in models and as well as humans. Normally this kind of wraps around the vena cava and runs around, but in this model they just show it coming down onto the base. So once again, this is the small cardiac vein, this is the middle cardiac vein. Notice they're both converging into that coronary sinus. And if we follow the coronary sinus anteriorly, we see the great cardiac vein. And so all of those, like I said, will come back to the coronary sinus and into that right atrium. And it's important to note there's a nice little valve there, because you might ask yourself, if the right atria is contracting, why isn't blood coming back? And that's why, because it's nice and closed off. And that's it.